Welcome, everyone. Thank you for taking the time out of your day to participate in this training program. Today, we'll be focusing on childhood diabetes, particularly how school staff can recognize symptoms, respond to emergencies, and administer insulin or glucagon safely when needed. This session is designed to boost both your knowledge and your confidence in handling diabetic-related situations. We'll also cover what Arkansas law says about administering insulin in schools. My name is Sharon Hill, and I'm an advanced nurse practitioner with a specialty in family practice. I am currently furthering my education and obtaining my doctorate of nursing at Arkansas State University. Part of this journey requires me to complete a quality improvement project. The goal of my project is to understand better the experiences and needs of students managing diabetes during the school day and to explore ways schools can better support the students with diabetes. I am going to do this by integrating an educational program to improve faculty's knowledge and confidence in performing daily diabetic tasks and recognizing when students might be at diabetic danger. The objectives of this virtual program, you will be able to recognize signs and symptoms of hypoglycemia and hyperglycemia, understand how to respond to diabetic-related emergencies, learn how to safely administer insulin and glucagon, understand Arkansas laws regarding insulin administration in schools, increase confidence in managing diabetic-related incidents. There are two main types of diabetes in children. Type 1 is the most common in school-age children and require lifelong insulin therapy. Type 2 is a more lifestyle-related and on the rise among children due to increasing obesity rates. Every child with diabetes should have a personalized diabetic management plan, which is created by their doctor managing their diabetes. Usually, this is part of their 504 plan or IEP, which outlines how to care for them at school. Signs and symptoms of hypoglycemia, also known as low blood sugar, can come on very quickly and is potentially dangerous. Symptoms you're going to look for is if the child is shaky, sweaty, pale, lack of concentration, or irritable. These are all classic signs. If you notice any of these signs, you will need to take action quick. Signs and symptoms of hyperglycemia, also known as high blood sugar. High blood sugar develops a little more slowly. Students might feel tired or weak, or drowsy, have a headache, need to urinate more frequently, or complain of blurred vision or nausea. Water and monitoring their blood sugar are key until the nurse or parent can intervene. Treating hypoglycemia when the student is awake. When a student is awake and experiencing some low blood sugar, you could give them fast-acting source of sugar, such as fruit juice, soda, or a sugar or glucose tab. We're going to wait 15 minutes, then retest their blood sugar. If they still feel off, then we'll repeat the treatment. Low blood sugar is known as a reading less than 70. You're going to always call for help. Severe hypoglycemia in a student that is drowsy or not safe to eat. This is a true emergency, especially if the patient is drowsy, unconscious, and you can't safely administer food due to the inability to swallow. Instead, you'll administer glucagon, which can come in either an injection form or nasal spray. You can only administer this if you are trained. If you are trained and or can't administer this, you're going to call 911, and you're going to always stay with the student until emergency or help arrives. This is what glucagon injection looks like. This is what glucagon nasal spray looks like. Treating hyperglycemia. Treating hyperglycemia, also known as high blood sugar, insulin may be needed, but only if you are trained and authorized to give it can you. Otherwise, if you're not trained, we're going to encourage the student to drink plenty of water to help flush out that excess sugar they have. We're going to keep an eye on their symptoms and call for medical support if their symptoms worsen. Never give them sugary food or drinks. This could further increase their blood sugar. Now we're going to discuss Arkansas law on insulin administration. According to the Arkansas law, trained school staff are allowed to administer insulin and glucagon. This is completely a voluntary role. You are not required to do this unless you've agreed to it and are trained by a qualified medical professional, which is normally the school nurse or a licensed professional that the school has hired. Now we're going to talk a little bit about how to administer insulin. Insulin might be given through a syringe, an insulin pen, or a pump. It all depends what the child is using, and every child may use something different. So you're going to always go to their 504 plan and look at, or their IEP, and look at what is in their medical plan for use. If you are trained, then you're going to follow this care plan very carefully. Sites where you could give the injections are going to be the back of the arm, the belly, or the leg. You're going to give it in a fatty area. You're going to clean the site and deliver the prescribed dose of insulin. Always monitor the student afterwards for any adverse reactions. We're going to go over this in more detail with hands-on training on June 13th. Building confidence. Building confidence, we know this can be intimidating, but with the right training and resources, you could absolutely do this. Make sure to stay informed by reviewing the students' plans, attending training programs, and keeping quick references materials handy. If you ever are unsure, always reach out to your school nurse or the student's parents. This is the references that I used in today's training program. I also want to take this time to thank you for taking part of this training program. We all want the same thing, which is to keep the students safe and healthy while at school. We know this will lead to better learning outcomes and development. I look forward to seeing each and every one of you at the hands-on training session on June 13th at 9 a.m. Please bring any questions you have to this session. Please make sure to complete the post-survey and quiz after this presentation. Once again, thank you.